This is a very controversial topic, at least in the United States. I'm not sure how controversial it is in other areas of the world, but certainly this is probably one of the most talked about, one of the most controversial topics we have in the U.S. These are my disclosures. My other disclosure is that I have never fused an SI joint for degenerative pathology. As an orthopedic surgeon, certainly for traumatic pathology, when I was in my training, before I did only spine surgery, we would deal with the SI joint. But as far as just separate individual sacroiliac joint degeneration, I have not done an SI joint fusion. And so what I'd like to talk about is how I view it, or at least some of the surgeons in the United States view the SI joint fusion, perhaps with the newer technologies, and how we look at it, and how it can be a little bit controversial. I think one of the first questions we ask ourselves is that, can the SI joint hurt? And I think we believe it can, from a surgeon's perspective, because it is a joint, it is innervated. There are studies showing that it can degenerate. I think we've seen some studies showing that it can be inflamed, and just like any other joint in the body, it can have problems. And so we see other areas of the body where there's degeneration, and we know that there's pain, certainly in the hip, the knee, and certainly in the spine. And we know that you can do injections, and you can give these patients temporary relief. And so to the answer, does the SI joint hurt? The answer is, yeah, we think it can. It makes sense. The problem is, how big of a problem is it? And can we make a difference? And that's where I think a lot of the surgeons, at least in the United States, that's where we have an issue. Because something doesn't make sense to a lot of us in the United States. And these are two of the studies that really puzzle us a little bit. The first one is that there are studies out there saying that there's up to 30% of the patients that have low back pain, it's coming from their SI joint. And so going back to my original disclosure that I have never fused an SI joint, I had to ask myself, am I missing something? Am I such a poor diagnostician? Because I see patients with back pain all the time, and since I've never done the fusion for degenerative pathology, am I just missing some of that? Maybe I'm not such a great clinician. I think the second study is something that's a little bit more puzzling to us as surgeons, and that is that up to 43% of people that have lumbar spine fusions will develop SI joint degeneration and SI joint pain. And again, I do a lot of fusions. But again, going back to my original disclosure, I have not fused an SI joint pain or a joint for just isolated pain. And so that really doesn't make sense to us. So we took a look at the Medicare database, which is the government insurance in the United States. We also took a look at United Healthcare, which is a private Humana, so it's a private insurance company. And we wanted to understand, at least in the United States, how big of a problem this was. And so from the Medicare database, which is the government database, we found that there were 150 SI fusions between 2005 and 2011, with an increase, as you can sort of see, around 2010. And so remember that. After 2009, around 2010, it went up, right? If you look at the private insurers, similar thing. There were 203 SI fusions between 2007 and 2011. And remember, this is the entire United States. So between those years, there were only 203 SI fusions, and it started going up after 2009, 2010, and 2011. So around the same time as the other Medicare database, we started seeing an increase in this procedure after that time period. And then we looked at patients that had a lumbar fusion. Remember the study I showed you where they said up to 43% of the patients that have a lumbar spine fusion develop sacroiliac joint pain, right? So if we looked at the database and we looked at the number of spine fusions, there's hundreds of thousands of spine fusions, which is the graph on the left. But if you look at how many of those patients had lumbar spine surgery fusion and then required an SI joint fusion, before 2009, the number was 0. Okay, so before 2009 in the United States, there wasn't a single patient that had a lumbar fusion and then required an SI joint fusion. And if you look at the cost, back in 2005, to do an SI joint fusion, the cost was $2,894. If you look at 2011, the cost has tripled to $6,843. So the cost increased around the time of 2009 and 2010. And so there are 3 points that we drew from this study. Number one is that something happened in the United States around 2010 where the number of procedures for sacroiliac joint fusions increased. The second thing is that the cost increased around 2010, and that there was an increase in the number of SI fusions after lumbar fusions starting in 2010 or 2009. So if we ask ourselves, at least in the United States, based on this, is the SI joint pain a real problem surgically? Okay, now, from a surgical standpoint, is it a big problem surgically? The answer is no. Because if you look, and again, this is the entire US population of Medicare, which are millions of people, there are only 150 SI fusions between 2005 and 2011. So it's not a big problem in the United States in Medicare or the private insurers. It's not a big problem as far as utilization of it surgically. But we have to ask ourselves, why the small numbers of SI fusions after lumbar spine surgery, and then why did this increase in 2009? So again, hundreds of thousands of patients getting lumbar fusions, but none of them needing a sacroiliac fusion after the lumbar fusion until 2009. What happened around 2009? Well, this is what happened. And so this is why it's very controversial in the United States, is because that's when the new technology came out for minimally invasive sacroiliac fusion. And this is the first, I think one of the first companies, SI Bone, and they were founded in 2008. And I think around the time of 2009, that's when they started selling that product and started marketing that procedure. And so now, again, I apologize to the companies that I left out. I went to Google and I tried to figure out how many companies have this type of minimally invasive sacroiliac fusion technology, and there are quite a number of them that have developed, and obviously the cost has gone up. But again, something happened at the beginning of this technology, and that's what the line represents. Once this technology came into view in the United States and we were able to use it, we saw the number of SI fusions increase in the Medicare database. We saw the number of SI fusions increase in the private insurance database. Is it something I did? Did the SI joint people, did the SI bone people are running the AV? Yeah. So I apologize to any of the companies that I may have offended. I didn't mean it. It wasn't. Thank you. Yeah, so that's a great question. So the question was, you know, did the companies, is it sort of a procedure that was popularized because of the new technology, or did we just become more aware of it? And it's probably a little bit of both. Yeah. One of the things that we're dealing with, and this is why it's very controversial, you know, in the United States, and I think probably worldwide, we're saying we need data. We need good prospective randomized trials. We need good studies to support the new technology. Well, in fairness to SI Bone, which is I think one of the largest companies that does sacroiliac joint instrumentation or minimally invasive procedures, they've actually got the studies, and they've done a lot of work to promote those studies, and they've done good studies. And NAS came out with a sort of a coverage policy for that procedure based on the fact that they had good studies. So I think that's probably a lesson for some of the newer technologies and the newer companies. If you do it the right way, I mean, there's a lot of ideas that are floating out there, but if you do the right studies, base it on evidence, that's sort of, I call it the currency of, I think, credibility. And so if you do the right studies, I think you'll have that credibility. And to their credit, they've done a lot of the studies. Now, one of the things that the opponents of SI joint fusion feel is that there's some bias if it's company sponsored. And that's something that probably we could debate all day. On one hand, we're telling them we need to do the studies, and then once they do the studies, we're criticizing them, saying that they are company industry sponsored. And there's probably some valid criticisms there, but I think there are probably some valid data in there. So the answer is I'm not sure. Maybe we are more aware of it. Is it popular here in Saudi Arabia, the SI joint fusions? Okay. Not very popular, yeah.
Yeah, I have done a few number of cases, but we can talk about this after the session.
Okay. So, so basically I was saying that there were no patients that had a lumbar fusion that required an SI joint fusion until the companies came out with this new technology, and then you can see the numbers have grown. And if we followed this out, we would probably see even a higher number of patients having this. And then obviously the cost comes into play. Now there should be a price for new technology, especially if it has perhaps a better outcome. And I think we're used, at least in spine surgery, to paying for the new technology. And so if you're doing a minimally invasive fusion and it requires more technology, it probably justifies a little bit more cost. But certainly the cost has gone up with the advent of this new technology. And I think some of the opponents of this say that they can still do this with some very inexpensive screws. And so why do I need this newer technology that costs 3 times as more? And I think that's also something to consider. So a lot of times, at least in the United States, as a surgeon, we ask ourselves, did the introduction of this new technology result in the creation of more surgeries? So is this the technology that's pushed it, or have they just made us more aware of it, which kind of is your question? And I think that's something we have to see. I think it's probably a little bit of both. But the other thing that I kind of compare this to, at least in the United States, is degenerative disc disease. We know that discs can hurt and they can degenerate and they can cause pain. And I think, you know, many years ago when I was going through training, doing fusions for low back pain for arthritis, that was kind of controversial too. And so maybe the SI joint is a little bit controversial like that. If you look at degenerative disc disease, I think there are a lot of parallels with the SI joint as far as how they're viewed, at least by the mainstream spine surgeons, and whether or not it should be appropriate. And then we have to ask ourselves, is there some industry influence on the early studies? And we look back at some of the technologies that didn't work out so well, and whether or not we need to look at new technology a little bit with more scrutiny. The last thing that we wanted to look at was, are there increased complications? And much like many of the other new technologies, if there's an industry-sponsored study, the complication rate is going to be lower. And I don't know why that is, and maybe they have their own internal data, but we looked at this complication rate just in these huge databases, and the complications are a little bit higher than what's reported by the industry sponsors. But the interesting thing is that you have to be very careful, as with new technology, because what this study shows is that if you do an SI joint fusion, you have a higher rate of breaking down in the lumbar spine and needing a lumbar fusion. And so that's why we have to be very careful when we're operating on these patients to make sure that we're doing the appropriate disease. Because the study they used is if you do a lumbar fusion, it's going to break down the SI joints. Well, this study that we did shows that if you do an SI fusion, it can have an effect on the lumbar spine and cause that to degenerate, and maybe you need a lumbar fusion. So you have to be very, very careful. So in summary, I think a lot of people agree that the SI joint, like many joints, can hurt. It can become pathologic and can be a problem. The problem is I'm not sure that SI fusion is the answer for that, and so we have to be very careful. Thank you very much.